Hi, my name is Tim Pawlik, and I wanted to talk to you about our paper, Trajectory Analysis of Healthcare Use Before and After Gastrointestinal Cancer Surgery. In the United States, cancer-related healthcare costs are expected to exceed $240 billion by 2040, and surgical services are an essential but expensive part of healthcare. Each surgical procedure can cost up to $50,000 to $150,000, and in fact, surgical operations are expected to account for about 7% of the U.S. gross domestic product by 2025. The objective of this study, therefore, was to use group-based latent trajectory modeling to characterize discrete patterns of healthcare use among patients who underwent complex oncologic surgery. In particular, we sought to evaluate patterns of healthcare use pre and post-surgery among patients with gastrointestinal cancer and to characterize the association with frailty. To do this, we used the SEER Medicare database from 2005 to 2020 to identify patients who underwent cancer surgery, either a liver, biliary, pancreatic, colon, or rectal procedure for a cancer. And then we used the claims-based frailty index to categorize patients relative to frailty. Group-based trajectory modeling was used to identify clusters of patients with discrete patterns of healthcare use, and then multivariate regression was performed to predict cluster membership based on preoperative factors, including frailty. Among the roughly 67,000 beneficiaries, we identified 4 distinct use trajectories based on clinical use of services in the 12 months before and after surgery. After a surge in use before the month of surgery, most patients reverted back to pre-surgery use and cost levels after the operation. However, a notable trajectory involving about 1 in 5 patients was identified, wherein surgery precipitated patients moving from a low pre-surgery use state to a high use post-surgery state that persisted. And of note, perhaps not surprisingly, frail patients were more likely to be among those individuals who transitioned permanently from low use to high use after a surgical event, being over 4.5 times more likely to end up being a high use, high cost patient after surgery. So in conclusion, what we demonstrated was that patients with gastrointestinal cancer demonstrate distinct clusters of healthcare use after surgical resection, and that preoperative predictive models may help differentiate different healthcare use trajectories and help identify patients, such as those who are frail, to help tailor care for patients in the postoperative period and identify those patients who will end up being high use, high cost patients long term after a surgical intervention. Thank you very much.